Welcome to this explainer. I am absolutely thrilled you're here today because we are going to completely demystify the NHS interview process. Whether you're applying for a clinical role or a non-clinical admin position, if you've ever felt overwhelmed by the thought of facing a panel, just take a deep breath. By leveraging the guidance we're going through today, we're going to break down exactly how you can prepare efficiently, strategically, and honestly with total confidence. Okay, let's dive right into this because I'm going to let you in on a massive secret about NHS interviews. Are you ready? The NHS basically gives you the test answers up front. No, seriously. If you know where to look and how to interpret the documents they provide when you apply, you can practically write your entire interview script before you ever set foot in the room. It's not magic, it's just knowing how to read their blueprint. So here's our roadmap for today. We're going to cover the NHS interview cheat sheet, decoding the person specification, mastering the STAR method, NHS values and transferable skills, and finally, tackling difficult interview scenarios. Let's kick things off with Section 1, the NHS interview cheat sheet. Now, these two documents are your absolute foundation. The job description tells you exactly what you'll be doing day to day. Things like processing referrals, maintaining databases, or dealing with the public. But the person specification, that tells you precisely what the panel wants from you, your qualifications, your skills, your personal qualities, is essentially their ultimate candidate wish list. Moving right along to Section 2, decoding the person specification. You see, the interview panel doesn't just pull their questions out of thin air. They build them directly from the essential criteria listed right here on the person specification. And a quick tip for you, in NHS HR speak, essential genuinely means essential. You want to scan this document for phrases like must have, knowledge of, or experience of. If they're asking for teamwork and maintaining confidentiality, they are literally going to design questions to test exactly that. Now, what's really interesting about this is how clearly that translation happens. If the specification says essential, ability to prioritize workload, the panel simply turns that into a behavioral question like, tell us about a time you had several competing priorities. How did you manage them? So for every single essential requirement on that list, you need to ask yourself beforehand, what is my exact real-world example that proves I can do this? Which brings us to Section 3, mastering the STAR method. The STAR method is basically your ultimate, repeatable tool for proving you meet those criteria. It stands for situation, task, action, and result. First, the situation. Just briefly set the scene. Where were you working? Second, the task. What was your specific responsibility in that moment? Third, the action. Now, this is where you want to spend the most time. Explain exactly what you did. Actually, a lot of people mess this up. Don't say we did this. Always say I did this. Give details on what you said, how you communicated, and what you documented. And finally, the result. Describe the positive outcome. What did your actions achieve? Using this structure guarantees a complete, evidence-backed answer every single time. All right, let's jump into Section 4, NHS values and transferable skills. Before we even get into your specific work experience, we have to talk about values. NHS organizations use values-based recruitment to see if your personal behaviors fit their specific trust. Take Oxford Health NHS Foundation Trust, for example. Their core values are caring, safe, and excellent. Caring means listening and treating people with dignity. Safe means you're alert to risks and report concerns promptly. Excellent means providing reliable, high-quality support. A quick pro tip here. Always look up the specific values of the trust you are applying to, because they absolutely want to hear you weave those exact words into your responses. So, the crucial point is this, and it's a big misconception. Unless the person specification explicitly states that prior NHS experience is essential, you literally do not need it. Your background in retail, hospitality, local government, education, or office admin provides incredibly strong, transferable examples. I mean, think about it. Handling a difficult customer complaint perfectly demonstrates the NHS value of remaining calm, showing empathy, and communicating effectively under pressure. Even for non-clinical roles, patient impact and teamwork matter immensely. It's all about how you frame your experience to match their values. And that leads us to Section 5, tackling difficult interview scenarios. We'll use a support time and recovery worker case study to see this in action. In almost any NHS interview, you'll be presented with some tricky, situational scenarios. The panel wants to see your patience, your professional boundaries, and your empathy. Say a service user or even a member of the public is reluctant to engage. Your response should highlight consistency and the ability to not take it personally. If they're in emotional distress, you show them you can remain calm, reduce the stimulation in the room, and ask very clear questions. And crucially, if there is a risk of potential self-harm or severe escalation, your answer must be to take it seriously, listen without judgment, and immediately escalate it to the appropriate clinician or manager. You are proving right there that you are safe and caring. Let's see how this builds into an actual real-world interview response. When asked how you'd recognize a deteriorating situation, a brilliant high-scoring answer includes a phrase kind of like this. I would record my observations separately from what the service user had reported and documented the escalation and agreed actions. See what that does? It shows the panel you understand objective documentation. You aren't making clinical judgments outside your role, you're reporting facts clearly and ensuring a safe handover. Now, I want you to pause for a second and just think about this question. What would you do if a service user refused support that was part of their care plan? It's a very common, very tricky panel question. How would you structure a star answer for this? I mean, would you try to force them? Would you just walk away? Well, here is the secret to a phenomenal answer. You would say something like, I would explore why they were refusing. Refusal is often linked to an unresolved barrier rather than a lack of interest in recovery. Boom. You respect their choice, you communicate calmly, and you adapt. By identifying that their refusal might just be anxiety or maybe a simple misunderstanding, you perfectly demonstrate the core NHS values of maintaining a person's dignity and delivering compassionate, person-centered care. To summarize our deep dive into these scenarios, there are a few golden rules you absolutely must showcase in your answers. First, show you have clear boundaries. Never make clinical decisions outside your role, period. Second, prioritize factual reporting. Describe observable behaviors, not your personal judgments. Third, you want to encourage independence, not dependence. If boundaries start to blur, you immediately seek guidance from a supervisor. And crucially, to prove you are a safe practitioner, you never ignore poor practice just to protect a working relationship with a colleague. Proving you follow these rules shows the panel that you protect the patient and you protect the trust. So as we wrap up this explainer, I want to leave you with a bit of a challenge. Take a look at your own resume today. Think about how you would answer, why do you want to work for the NHS? Which of your everyday experiences, whether that's handling a complex team project, maintaining a messy database, or de-escalating a really upset client, is actually a perfect, evidence-based star answer just waiting to be told? You have the blueprint now. The test answers are sitting right there in the person's specification. The only question left is, are you ready to stop just applying and start proving it?